Fitz-Hugh-Curtis Syndrome by Jocelyn Castillo. First, definition. Fitz-Hugh-Curtis Syndrome is a chronic manifestation of pelvic inflammatory disease, PID. It is described as inflammation of the liver capsule without the involvement of the liver parenchyma, with adhesion formation accompanied by right upper quadrant pain. A final diagnosis can be made through laparoscopy or laparotomy via direct visualization of violin string-like adhesions or through hepatic capsular biopsy and culture.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today.
Pelvic inflammatory disease, or PID, is an infection of the upper female reproductive system, including the uterus, fallopian tubes, and ovaries. It can cause a number of serious complications, including infertility. The female reproductive system includes all of the internal and external organs that help with reproduction. The internal sex organs are the ovaries, which are the female gonads, the fallopian tubes, two muscular tubes that connect the ovaries to the uterus, and the uterus, which is the strong muscular sac that a fetus can develop in. The neck of the uterus is called the cervix, and it protrudes into the vagina. At the opening of the vagina are the external sex organs, and these are usually just called the genitals, and they're in the vulva region. They include the labia, the clitoris, and the mons pubis. The vagina, uterus, and fallopian tubes all have a mucosa, which is a layer of epithelial cells that lines the inside of these organs. PID usually develops from a bacterial infection in the vagina or the cervix, which causes inflammation of this mucosal layer. About 60% of the time, this changes the composition of the bacterial flora in the vagina, also called bacterial vaginosis. Because the reproductive tract is essentially one long tunnel that starts at the ovaries and ends at the external sex organs, the infection can travel up that tract pretty easily. And some mechanisms can make it even easier. For example, the cervical mucus, which normally acts as a barrier preventing bacteria from entering the uterus, can become less effective. The mucus can become thinner as a result of normal variations throughout the menstrual cycle, or, alternatively, it can become less effective in the context of bacterial vaginosis, which is when the normal balance of the vaginal flora is altered, and anaerobic bacteria proliferate and degrade the cervical mucus. Other factors contributing to an infection may be retrograde menstruation, which is when menstrual blood flows back through the fallopian tubes and into the pelvic cavity instead of out of the body, and also sexual intercourse. Now, PID is most problematic when the infection reaches the fallopian tubes, in which case it's called salpingitis. If it also affects the ovaries, it's called salpingo-oophoritis. The infection triggers a response from the body, which sends in neutrophils, plasma cells, and lymphocytes into the fallopian tubes. That sounds like a good thing, right? But this actually damages the tubal epithelium, and the tubes become filled with pus. When scar tissue forms to repair the damage, areas with damaged epithelium tend to stick to one another, creating closed-off pockets and little dead-end pouches in the fallopian tubes. This scarring in the fallopian tubes can lead to a number of complications related to PID. If pus builds up in the tube and ovary, it can turn into tubo-ovarian abscess, which can be life-threatening if it ruptures. If a watery fluid builds up in a pocket created by scar tissue in the tubes, this is called hydrosalpinx, and it can cause the affected area to become swollen. In general, because of the structural damage it creates in the fallopian tubes, individuals who have had PID tend to have more difficulty getting pregnant and have a higher risk of ectopic pregnancy and chronic pelvic pain. One last complication is Fitz-Hugh-Curtis Syndrome, which occurs when the inflammation from PID spreads to the peritoneum and, from there, to Glissen's capsule, which surrounds the liver. This results in violin string adhesions, or thin strings of scar tissue that attach the liver to the peritoneum. There are many different bacteria that are associated with PID, but the most common are Neisseria gonorrhoeae and Chlamydia trachomatis, which are responsible for the sexually transmitted infections gonorrhea and chlamydia. Occasionally, PID can be caused by other forms of bacteria introduced into the reproductive tract by surgery, abortion, or even normal vaginal childbirth.
Applications in nursing. Typical patients with VHCS are women or childbearing age who visit a hospital with complaints of acute pain or chronic tenderness in the right upper abdomen. A thorough history and high index of suspicion are necessary to reach an appropriate diagnosis. Right upper quadrant abdominal pain is a symptom of myriad pathologies including, but not exclusive to, cholecystitis, pleurisy, right pyelonephritis, subphrenic abscess, or herpes zoster infections, making an assessment for FHCS particularly difficult. Pros and cons. Pros. There is insufficient data documenting the prognosis of VHCS as it usually responds to antibiotics very well. Cons. Complication. One of the most common complications occur in patients with Fitz-Hugh-Curtis Syndrome is infertility. Another rare seen complication is bowel obstruction, the adhesion formation in the peritoneal cavity. Issue apply in Ecuador. The diagnosis is more clinical than an ultrasound. Normal pelvic echo does not rule out PID. 20% of women with PID have complications such as infertility. 30% have chronic pelvic pain and 1% could develop an ectopic pregnancy. Conclusion. Fitz-Hugh-Curtis syndrome is a rare complication of pelvic inflammatory disease (PID) involving liver capsule inflammation, leading to the creation of H-shots. The condition is named after the two physicians Thomas Fitz-Hugh Jr. and Arthur H. Curtis, who first reported this condition in 1934 and 1930 respectively. Thank you.